A team of researchers at Georgia Southern University is launching a new initiative to combat the opioid crisis.
That's right. Eden Hodges shows us how this team is focusing on rural communities.
Georgia Southern Center for Addiction Recovery is receiving nearly $800,000 for their research into Georgia's opioid crisis.
When we think about addressing opioid use, we think about the continuum of care.
Robert Bowler is one of the professors involved in 4 projects by the group.
We think about prevention, harm reduction, treatment, and recovery.
He tells me those 4 pillars shaped their projects to take a deeper look at opioid addiction in rural areas. They're working with personnel at 30 rural hospitals to teach addiction treatments and how to safely prescribe the drug.
Substance use patterns are different in rural areas. Treatment access is different. Recovery support resources are different in rural areas.
For their recovery and support, they're training people at local addiction recovery centers, and they're furthering their collegiate recovery program for students battling addiction.
Early on, rural areas were particularly hit hard by the opioid crisis because they experienced increased opioid prescribing compared to urban areas.
Bowler tells me their research project will look at harm reduction strategies to lower the risk for those who struggle stopping the drug.
Part of this funding is really aimed at innovative solutions.
And that was Eden Hodges reporting. So Georgia Southern says that the work is set to begin this month and will continue over the next 2 years.